Hey y'all, hey, it is me, it is your girl Nurse T. Welcome back to my channel. Today is Vlogmas day 9, and fortunately you guys will get a chance to see me out in the community. I'm actually going to do this sit down vlog with you today. I actually just came from a home care patient, a home health care patient. So today this video is going to be about being a pediatric home care nurse. All right, y'all, so if you stumbled across my video and you're like, who is this girl sitting in her car about to tell me about pediatric nurse? So I just thought, because I know I've had some new subscribers along the way, and a lot of you have came across my channel based on me just maybe posting it on TikTok, posting it on Instagram, or just stumbled across any other video that I might have caught your attention on, and then now I'm popping up in this pink scrubs. Well, if you don't know me already, I am a registered nurse. I've been in healthcare generally since 2006, but I've been a registered nurse since 2015. I have a history of working so many different specialties. I'm currently a float pool nurse at one of the largest hospitals in Houston, Texas, and I'm also doing some things in the community. I've also recently dabbed into some entrepreneurship, in which when I feel like I'm a little more, when my feet are planted and I have really good information to offer on that, and when I feel like I'm kind of thriving in that industry, I'll share more with that. So I have that under my belt. I'm also maybe like the past year or so, I've been doing pediatric home care. I dabbled and dabbed in pediatrics since I became a nurse, but this is the most consistent that I've been in it. Just kind of like have an overall, I'm well-rounded with adults and kids. And then I also, within this past year, tapping into entrepreneurship. You know, I started a business, a home care business. And like I said, I'll tap more into that when things are kind of like going at a steady pace to where I feel like you can really benefit from my information. But a part of that, I do some assessments here in the community. I am partnered with one of the adult daycare facilities, and I typically go out and do assessments with this particular lady that I know that runs this agency, well, that runs this facility. And maybe later on down the line, maybe I can bring her on, introduce you to her, and just kind of give y'all some information on being an assessment nurse. Well, today I'm actually going to go out. I have like 5 clients to see with her, and pretty much probably on the next video I'll discuss what's my role into going into having a contract with, you know, some of these daycare facilities, or, well, this is an adult daycare, but that'll be in tomorrow's Vlogmas day 10. You know, so I'm going to do it today, but I'll make a video on it for tomorrow. So stay tuned, subscribe to the channel. If you have any questions, ask them down below. Like, comment, share. Share with those other aspiring nurses that you may know of, or if you just want to share it, help a girl out. As a fact, matter of fact, right now, if you're on your phone, or if you're watching me from the TV, if you're watching me from your phone, go ahead and help your girl out. Hit that like button, leave me a comment, even if you just say thank you for the video, something to show engagement in my videos so my videos can be pushed out. And when you're done with this video, if you can go watch another video, 2, 3, 4, 5, 6, 7, 8, 9, 1,000, whatever videos, share something, like something, comment something, and say, hey girl, I'm here, I'm supporting you. In 2025, I'm trying to like really move in a different way. But for those of you who are still interested in becoming a nurse, this is your girl. Like I said, you'll see my nurse life, like me. I don't take my phone and go out and video record anything at work. I had some haters on my page at one point let's just say I don't make those come to work with me videos anymore. There's a lot of true haters out there, just know. And for those of you who make those videos, watch your back, because there's always going to be some haters that's watching you. Not everybody want to see you girl thriving, right? So unfortunately, you work with some people who don't want to see you thriving. But at the end of the day, you can protect yourself at all angles. You can do what's right at all angles. But when somebody wants to rain on your parade, they're going to try very hard to do so. But anyways, it's innate within me to be an educator, to teach, to help people grow, to make you feel comfortable. And if you feel comfortable with some information that I give you, then I've done what I needed to do. So today in this video, we're going to talk about how do you prepare yourself to becoming a pediatric nurse, what it takes to become one, what type of skills, what you need to do, and just nursing in general. So pediatric nursing, Nurse T, why pediatric nursing? Okay, y'all, so before I even got into healthcare, I always thought I wanted to be a pediatric nurse, a neonatal nurse, a pediatric nurse, one of the things that's dealing with kids. But fortunately, when I landed my first job in healthcare, I worked at, well, like I said, one of the largest hospitals in Texas, well, in Houston. I worked there and I started off as a CNA. I had my certified nurse assistant certification, and I used that, got a job at one of the big hospitals here. And the title that I had while working in a hospital was called a patient care assistant. So we assisted the nurses and we helped patients with activities of daily care. Basically teeth brushing, grooming, getting them up walking, checking vitals, and reporting all these necessary things to the registered nurse or to the nurse in charge. After that, while working, it gave me the idea. I was surrounded by people in healthcare, so I could determine if I wanted to do physical therapy, speech therapy, respiratory therapies, registered nurse, whatever. And of course, I decided, yes, I'm going to stick with nursing. So I went to school. I got my bachelor's degree from Chamberlain College of Nursing. Now I think it's like Chamberlain University or something. So I got videos on here about Chamberlain, so y'all can check those out. Keep in mind that's been over 10 years or been near 10 years. So a lot of information has changed. I'm going to see if I can get one day, if I can do a sit down with a person. I know a girl that I used to work with who she currently attends Chamberlain, and maybe we can collab and she could talk about some changes, and we could together talk about maybe some things that they currently do now that I probably didn't do while I was there, because I know they offer so much more. So I would really like to bring her on and just kind of like collab with her, answer some questions for those of you seeking that route as far as in getting your degree in nursing. All right, y'all. So jumping back straight into pediatric nursing. Why am I doing pediatric nursing? Well, after dealing with adults for since 2006, and I still work with adults now. When you're seeking to work outside the hospital and work more into the community, there's home health care. There's home health care for adults where I recently, maybe about a couple of months ago, I started doing some home health care where I would drive to the adults' houses. But the particular company that I was working with, the houses were so far out. I love the experience because I got a chance to, I don't know where she get these clients from. I feel like they were all millionaires or close to millionaires, but I was more impressed by their way of living, and that they, they had money to provide, to receive all these services that they were able to get, at such older ages. But she had some high profile clients, and I really enjoyed that. But I didn't enjoy the driving, the miles on my car, the gas that was wasted, and then all of that, and then what you're paid per hour. It wasn't just equaled up to it wasn't, the math wasn't mathing. Basically, there was a set price you would get for a visit. There was a set price you would get for a start of care, for a discharge, and by the time you drive an hour away, an hour back, and the amount of charting that you have to do, I learned very quickly that doing home health care for the adults is just really wasn't my thing. So with the kids is more simple. There's so many kids out here that are in need of home care. You have so many kids that are born with cognitive difficulties, a deficit, shall I say, and it requires the need of some care at home once they leave the hospital. So there, voila, that's where your girl come in at. I use my expertise of working in general in healthcare, in nursing, and then I just kind of modify it to taking care of kids. Now, kids and adults, totally different ball games. Kids and adults are totally different ball games. Once you work with adults, sometimes you don't want to work with kids because you're like, oh, like it's the realm is different. For me, it is. And then kids, once I learned kids, because there are certain diseases that affect adults and there are certain diseases that affect kids, and then mutually there are diseases that affect you, whether you're adult, kid, whatever, and it's pretty much the same. You just got to know how they present in different ways when you're a kid versus an adult. All right, y'all. So with me working in a hospital, I can work a minimum of 3 shifts. I could pick up whenever, but sometimes like after you do your 3 shifts in a hospital, if you work in a hospital, you already know it's let's just say the workload in the hospital is, they putting more and more on your girl. They putting more and more and more on your girl to where sometimes you leave feeling tired and defeated. And at the end of the day, I enjoy what I do, don't get me wrong, but I cannot do that so many days out the week, because overall it can be a stressor mentally and physically. But when you out there trying to secure a living, as we all know, it's not a surprise, the cost of living is very high, especially if you're a single mother and you're raising your kids and you like nice things and you want to expose your kids to nice things. And a lot of us don't wait for handouts. I'm blessed and I'm thankful to have family that are there to help me out. I am blessed to have their father that contributes when he can contribute. But at the end of the day, when things need to be done, things need to be done, and not at all times you can count on people to just really be there to be the helping hand you need them to be. But again, I'm very thankful. I have a support system that's so strong, y'all, so strong. And I'm just thankful for them. But in the meantime, in between time, when I need to secure the bag, or if something coming up and I need to make sure that I have the funds for it, as a registered nurse or a nurse in general, there are so many things that you can get your fingers into, and yeah, you can just kind of make your money. Now, there are things you can get into, and then there are smarter things you can do, which can make your money multiply, or you can stack even bigger. And of course, I feel like that's entrepreneurship, but it's not always as easy. It's a lot of work, but anything worth having, worth working for, right? And a lot of people, they say Rome wasn't built overnight. A lot of businesses that people have that are doing great in number, trust me, it wasn't built overnight. And for every win they won, they had a loss that they took. And it's just a matter of, are you ready to tackle all of that, So unfortunately, like if you need money right now and you just need to get in it or whatever, there are so many things you can do in the healthcare field, and one of them is pediatric nursing. Okay, but I would say this, and I would say this with anything you do, especially in nursing, don't just do it for the money. All right, yes. So don't just do things for the money because it will show, for number one. And number two, when you work with patients and they know that you're not compassionate, that you have no interest, like that's kind of like one of the worst things you can do, because then you put stress on yourself because you're not even interested in what you're doing. But anyways, y'all, let's just jump straight into it. Okay, so in home care, what can you expect in home care? Like as a home care, home health care registered nurse. So let's just use me, my typical day. So what I do is, because I don't have set patients that I see, but I get like a roster of, because this is me working for a company. I have like a roster of patients who need a nurse for the day. You have some nurses that they have their set people that they go to. Then you have a person like me, depends on when I'm free during the week and what day I want to pick up, and depends on what kind of money I'm looking to earn or whatever, that determines how many shifts or whatever. I can look at the roster and see, okay, this kid has this going on, and I'll pick up that assignment, or if I don't want to pick it up, I don't have to, whatever, So let's say I pick up an assignment, I get the plan of care, and it goes over like the medical history. It's important to know the medical history of the patient so you can know, are you competent and confident to even work with that particular type of patient. Let's say if it's a patient with seizures or some type of malformations, patients with shunts, patients with heart difficulties, neurological difficulties, musculoskeletal difficulties, those requiring certain level of intense care, like, you know, maybe they might be on a vent, they might have a tracheostomy. How skilled are you, and how many years in healthcare or in nursing do you have to feel competent and confident enough to even take on that take on that assignment? You have to keep in mind that when you take care of patients in the hospital, you have your support team with you. So if the stuff pops off, you know, you can hit a button and call that code blue, or make a phone call and call for a CERT or a rapid response. And you're going to have your team that's going to be a doctor, a pulmonologist, an internal medicine doctor, a pulmonologist, a respiratory therapist, the hospital administrator. Like, you're going to have your whole team with you, and you have your colleagues, you have your peers that got your back. So if it's something you're not knowledgeable on, like something that's not your expertise, you know, everybody putting their heads together and they can come up to the conclusion of what's going on with this patient. But when it's you by yourself and you're in the home with a patient, and the patient begins to have a seizure, you have to remember what's the protocol when a person is having a seizure. You know, so if it's me in that scenario, the first thing I do is know to protect their airway, right? So a lot of times when you have seizures, a lot of patients, they tend to foam at the mouth. So if you foaming, you know, and a person is on their back and they seizing, you want to be able to protect their airway, and, you know, so you turn a patient on their side, number one. Number two, you got to make sure that the coast is clear, like the premises is like anything that they can maybe shake, jerk, hit their head on. Let's say they hit the floor and they are jerking and they're near a bedpost, you know. So if they can potentially bump their head, which can make things worse, like the goal is to, you know, to protect their head, protect their airway, turn them on their side, don't stick anything in their mouth. And then, you know, you monitoring the seizures, you're counting the minutes, you know, the seconds. Every second is important, you know. So then you have to know the order set that you have already in place. If a person have a seizure over X amount of time, administer this. And if you administering it, what route are you giving it? Are you giving it via a nasal spray? Are you giving it via a rectal suppository? Like, what are you doing, you know? So it's good to be familiarized with the type of medical diagnosis that the patient have, and potentially what you might encounter if you go there. So if I have a person who have heart issues, I'm going to look up that heart issue and determine, like, what are some signs? What are some common signs? Are they going to have cyanosis, which is like, you know, the lips are going to start turning a different color? Are they going to show signs of use of accessory muscles when they can't breathe? Meaning that, like, some of them, they put themselves in a position, or a lot of kids, they put themselves in a position to where they can breathe better because they have issues with their cardiovascular system. Or if a client is having an asthma attack, are you familiar with using an inhaler? Are you familiar with the rescue inhaler? Are you familiar with, if that rescue inhaler is not doing the thing, what are you going to do next? You know, if the just depends on the medical issues that they have. You want to make sure that you are competent in that particular area. So again, before you take on an assignment to make a couple of few bucks extra, just make sure before you take on an assignment that you have some education behind whatever it is that patient is going through. Even in a hospital setting, when you get in your report and you know these people's lives are in your hand for 12 hours, you want to make sure that you kind of know what's what. So when you're in nursing school, that's why I tell you it's imperative. It's not that you're studying for that test. You're studying for life. Like, you're studying so that you can have this information for the NCLEX, that big scary test at the end, that qualifies you to become a registered nurse, not just a graduate nurse, but a registered nurse or a licensed vocational nurse. Like, when you're studying in school, in nursing school, you're not just studying to memorize, you're studying to remember, because it's cumulative learning. Like, what you learn in this semester will feed off in this semester, and in this semester. We can go on and on, but that's going to be another topic for another day. But anyways, you take that information you learned in nursing school. I'm pulling information out of my information bank that I've, inquired or gained in my knowledge bank over 10 years ago, and I'm pulling it out now, because sometimes you might not work in that area. I'm float pool. I work float pool in the hospital. So in the hospital, I work different floors every day. One day I'm in the emergency room. Next day I might be in mother baby. Then I might be on a cardiovascular floor, a neurological floor. I might just be in observation. I might have a patient with, so I'm constantly pulling from that memory bank of what happens when I have this patient. What happens when I have this? What can potentially happen if I have this patient? So anyways, y'all, I don't want to get off topic, but I feel like I am. Going back to pediatric nursing, when you take on that assignment, you just want to make sure that you review the medical history of the patient. And so today, what I did today was a meet and greet. So I have a new client that I'm going to be seeing later this week. So although I have a layout of what I need to know medically for her, it's important to also know, when you're dealing with kids or even as an adult, what are some special things that I can do that can really get you through the day. Like, I want to know your favorite TV show. I want to know, like, when are we going to have, like, reading hour, stuff like that. That's not going to be on the plan of care. The plan of care, basically, the patient plan of care, it lines out, patient need tube feedings at this time. Patient has a G tube, a J tube. Patient need these medications administered at this time. Patient G tube need to be flushed at this time. Patient needs to have incontinence care at this time. Patient needs to be repositioned Q2 hours. Assess the skin. What is the skin that you can kind of expect when documenting in pediatric care? A lot of times there are apps that the company may use, that they use in order to, like, keep all their data, on the app or whatever. So I guess whenever it's time to submit to state or whatever, everything is aligned. So they kind of they have a layout of what they want to know, like the vital signs, everything I just named, as far as in the medication administration, and did the patient tolerate it, how much fluid was given, this and that. Like incontinence care, was there a wet soil diaper? Is the patient having constipation? Then you got to do your head to toe assessment, head to toe, that including everything from the tip of the head to the bottom of the feet, and including vital signs. How were the vital signs? Were there anything abnormal? Then you have to do a beginning shift nursing narrative report. Like, you start your shift, what can you anticipate? And then the end of shift narrative note, like, how did the shift go? Like, basically a summary of basically things that took place during your shift, or like you as a nurse, what did you do to keep the patient safe? Any type of physical activities that may have went on, like, did you apply any, like, special AFOs, like any splints? Did you get the patient up? Was the patient ambulatory? Did you get him in a wheelchair? So it's a lot of documentation. But I will say this, a lot of that sounds scary, but once you're comfortable, like at the beginning of everything, there's going to be that anxiety level, because it's the fear of the unknown. But anything you're brought to, you'll get through, So repetition is key. The more you expose yourself to something, the more and more comfortable you'll be with it. So a lot of us, we tend to fear, things that we're not used to, because we don't know what to expect. It's not until, we've done something to where we feel like we kind of sort of master it, to where we have that comfort level. But in healthcare, don't ever feel like there's nothing else to learn. There's always something to learn. There's always educational classes, continuing educational classes that you can use to gain, you know, just for your own personal knowledge, or just so that you can have for your profile and to make yourself more marketable. Like I stated, well, in one of my other videos, you saw that I got a certification. I'm already a registered nurse, and I had to become a registered nurse by taking that NCLEX at the end of my program. But once you're out in the field of your chosen field, you can go and get certified. You can get board certified. So I have so a lot of times when you see nurses that walks around with this certified badge, that means they took the initiative to go and get certified in that particular field of study. Like mine is in med surg, so I'm board certified in medical surgical nursing. You can be certified in chemotherapy, board certified in critical care. There are different specialties where you can go get board certifications in. And it's just like kind of preparing for the NCLEX all over again, but it tests your knowledge. You know, it helps you to identify what you do know and what you might need more work on. Nurse T, what are some things that can prepare me to work in this field as a pediatric registered nurse? Well, again, for starters, you just need to complete your nursing course, whether it's an LVN, because there are a lot of LVNs that work in the home health care industry. You could be a registered nurse. You can even be a patient care assistant and do like the daily activities. What's going on? It look like it's just the lighting went out or something all of a sudden. But yeah, so you can even just be a nurse assistant to go out, and they have nurse assistants that go out and take care of patients, like doing activities of daily living, giving baths, oral hygiene, making sure that they're groomed, dressed, maybe help them tidying up their homes, just medication reminders, like just reminding them, hey, you need to be doing XYZ, not administering it, but just reminding them of those things that need to occur on a daily basis. Other little things that can help make you a little more comfortable, like education wise, being in the home working with either kids or adults, is, you know, anybody can be at risk for going into cardiopulmonary respiratory failure or whatever, you know, cardiac failure, respiratory failure, anything of that nature, which incorporates you to have to use some CPR skills. So working with kids, they do have the PALS certification that you can obtain to better familiarize yourself, like when a kid is in distress. Then they have the BLS, basic life support, just kind of knowing the average of what you need to do to sustain a life until the paramedics arrive. Then they have just heart savers, where probably the very basic, where you just need to know basic standard CPR. So there are things you can do with that. You can also get certified in pediatric if you're a registered nurse, and it just means that you're more of an expert in your field of study. So I feel like anything that you put yourself into, like, I want to be the best at what I do. You know, I'm not going to be the best at everything, but I want to be confident. There's nothing more that gives me anxiety than to be put in a situation and not have information on it. That gives me anxiety. So even before I go, even if I took 10 minutes just to research something, like, that would boost my confidence 10%, just so that I'm not going into something like with no information or whatever. All right, y'all, so since the last portion of this video, I've had dinner. Well, I ate some lunch, so now I'm about to head on to my next location, which is I'm going to be doing some assessments at a adult daycare. So they got about 4 or 5 people to assess there. So anyways, y'all, I'll look forward to sharing that information with y'all on Vlogmas Day 10. So if you haven't already, don't forget to subscribe to the channel, comment, like, share. Leave me about 3 pink hearts so I can know you made it to the end of this video. And I'm gonna go ahead and get off this camera because I'm back rolling. Talk to you later. Bye.